Hello, everybody, and welcome. Now we'll talk about the future of teledermatology. It's an interesting business to try to make diagnoses from afar. And it's not always accurate, but it's comfortable. So teledermatology is going to stay, and let's see what the future holds for it. So there's a global undersupply of dermatology services. You're aware of that. Patients have to wait for 4 months, including in my department, unfortunately, to get an appointment. They often travel long distances. Even in Switzerland, that's so small, but still they have an hour until they are with the dermatologist. And patients often stay for many years with a physician who may not be completely qualified to treat their skin. There's also a coming shortage of dermatologists. We have data that the German dermatologists in practice, 2/3 are over 50 years old, and it's not clear whether they are all going to be replaced so easily. And if you check the demand, 1/4 of the population need dermatology services per year, but 70% of these cases can be treated with teledermatology. We checked what patients want in an interesting little study that we did with questionnaires on various levels, university as well as private practice. 3/4 want digital services, that is clear, regardless of what age. 3/4 want digital prescriptions. And they want electronic registration forms, that they don't have to fill any paper, and they want to make appointments online. And that's what we implemented first now. That's really comfortable for patients. They can just select what appointments they want. And only 1/3 actually wanted teledermatology services when we asked them. But of this part, 2/3 would pay themselves for a teledermatology service. And that's why we started to offer this and made a startup that allows teledermatology to patients to pay directly, and they can then reimburse it with their insurance. So the patients drive demand for this. During the pandemic, the number of requests rose sharply, and we do that very, very frequently now. And it's the fastest growing area of telemedicine in the world, teledermatology. Check out this data. So in 2016, you have 4 billion teledermatology and 10 billion telemedicine overall. And teledermatology is projected to be 44 billion in 11 years. I'm not sure whether I believe that, but certainly it's going to grow. That is clear, even from our data in Basel, Switzerland. So the best age for teledermatology actually seems to be when you are at age 0 or 1, because your parents, they love to do teledermatology, don't have to leave the house. Then it drops a little bit, and then you are probably the population that is listening to this now. That's the typical population that is otherwise consulting in teledermatology. So there's different systems. Teledermatology can be done store and forward. So making a picture and filling in a questionnaire, or it can be done by Skype, for example, live video conferencing. For us, it's clear we prefer store and forward, as we don't need an appointment. For video, I've done this too, but you need an appointment. It takes up your time equally as normal consultation. Also, quite a few patients feel uncomfortable undressing, for example, their genital region in front of a camera that transmits via the internet. So that is an issue sometimes, but there's plus and minuses of both techniques. For me, it's important that you just know the difference. So the way we do store and forward teledermatology in Switzerland is a patient detects a skin problem, seeks help. Dermatologist carries out a diagnosis and prescribes treatment and medication, and the pharmacist can then send out medication conveniently to the patient's home, and the therapy can be started. When we check out what diagnoses are suitable? I can tell you patients know that themselves quite well. So dermatosis for teledermatology should be quite unambiguous regarding its visual features. You should be able to make the diagnosis without histology or labs. There shouldn't be any high-risk differential diagnoses with lethal outcome, for example, and you should have treatments that are non-toxic so that you can treat without making 100% sure whether it's actually the right diagnosis. And there should be some clear treatment algorithms. If you have neoplastic or infectious mimickers, for example, it may not be suitable to treat a patient via teledermatology, as you do need biopsies or labs. And so for psoriasis, we find that psoriasis fulfills most of the criteria. So you can treat psoriasis quite well with teledermatology. There are some features that cannot easily be seen on photos. For example, erythema depends on lighting, infiltration can't be felt, and so on. Many regions can't be photographed so easily, especially if the patient's alone. But then you can get the symptoms quite well by questionnaire, patient-reported outcomes, and also the risk factors can be seen on the questionnaire, if not the intrinsic risk factors. Also, the arthritis can be checked quite well, as the next speaker might mention. So the therapeutic pyramid in psoriasis, can that be done with teledermatology? Well, there's a few safe treatments that can be prescribed without risking that the patient has an immediate side effect. There's always a risk, but it can be put into perspective. And so there have been studies by April Armstrong and others who have done 2 cohorts and seen whether patients that were randomized to online care or in-person care, whether they had a different outcome in psoriasis. And actually, you can see if you check the PASI score, the severity score in psoriasis, there is no significant difference. So it's actually quite nicely treatable with teledermatology. In the future, we will also use the pictures that are taken for segmentation, so checking what actually the score is of coverage and also the PASI score. We want to calculate this also for pustular psoriasis. As you can see here, we can have 36 pustules. That is important so that we have objective measures when we go in a situation where we don't have the patient in front of us. There's some issues with ethics. So teledermatology companies sometimes sell drugs. In Switzerland, that's not allowed, but in the US, apparently it is. So this case where a patient had erectile dysfunction after finasteride that was prescribed by teledermatology for androgenetic alopecia. Apparently, there was no comprehensive patient information. A risk was not checked for this side effect before prescription. And the platform that finances itself by prescribing medicine and therefore making the consultations really inexpensive, there is a clear conflict of interest there. And that should be looked at in detail. With teledermatology, we will lower our no-show rates. You can see here, that's data from the US. So according to this study, the no-show rate in all the groups that were studied here is much lower than when you see them in a live consultation. Much more comfortable, right? So that's a big advantage. And the satisfaction with teledermatology is quite high. So with the response latency, almost everybody is satisfied, and also the majority would consult again. What do we see in such a store and forward services? So acne, rosacea, eczema, that's all stuff that patients know. The dermatologist will be able to say something about it. I also put in psoriasis here, it's less than 10%, but that's suitable as well. There's not so many patients who consult with potential melanoma, for example, because they know in the end that has to be looked at with dermoscopy or even with a biopsy. Now, patients are going to be empowered by Google So in autumn in the EU, we'll have artificial intelligence. People can make directed photos of their skin, fill in a bit of data, and then get the differential diagnoses. I wonder how that's going to come out, because there's pluses and minuses. In the end, I guess patient empowerment is always good. If the patients get shown melanoma, because there is no risk factor here, right? So you don't get any percentage. So obviously for every nevus, there should be a differential of melanoma. I wonder how many patients are going to be really afraid. And these kinds of algorithms, they were also studied towards supporting normally not that qualified physicians for dermatology, or even nurses. Now here, 40 people, 20 nurses and 20 family physicians, GPs, were supported with this Google algorithm. And the algorithm was able to improve the diagnosis of the dermatoses in 10% or 12%. And you can see that the confidence of the top diagnosis rose quite a bit when the clinicians were supported with this algorithm. How well that is implementable, I don't know. It's certainly not in the interest of dermatologists that this is done systematically, but I think it's just a development that we dermatologists have to observe and react to. So potential conversation in 2025 will be: the app predicts an invasion depth of over 1 millimeter with an algorithm here. So already says it's melanoma, and it's also deeper than 1 millimeter. It can also predict whether it should be excised, with what margin, so we can potentially save the patient an additional surgery. Also, maybe the patient has palmar psoriasis will be set by the resident, and then the professor is going to say, okay, did you rule out mycosis, and was the diagnosis confirmed with the app? Because we're going to check our diagnoses electronically for sure. That is a development that has been seen time and time again, every time a technological advancement comes up. So the initial diagnostics in teledermatology will be democratized, soon be available free of charge for patients. Whether that is going to be inducing fear or relief will be seen. The intervention and the counseling will not be free. That's still the dermatologist who has to do that. And prescriptions will surely be done by teledermatology more often. And psoriasis and other inflammatory conditions are suitable teledermatoses that will also be analyzed automatically.